Hi, good evening to everyone. Thank you very much for joining me. Now, this is the first session of McMillan and Members Health and Wellness Network. Now, I'm doing a dual presentation. So I am presenting live on YouTube, and I'm also presenting in my Zoom presentation at the moment. And so for the people who registered, they are in the Zoom. And what we will do is after a short discussion, I will then switch off from the live and then we will continue with the Zoom conversation. The reason I'm doing that is largely because I want to encourage everyone to get involved in this journey. Now, there will be a limit to the numbers, and I'll try and work that out at the beginning. We have a good number of people directly in the Zoom, and I'll try and work out the best way to answer the questions. But let me tell you why this is important. We are moving ahead of the science here. This is not following the science. We are going ahead of the science. So a lot of what we say here can't actually be fully understood. But here is what I'm focused on with regards to the COVID storm. You can see here this presentation. What I've been looking at is the immune response, especially macrophage activation. And the reason why people think it's just about COVID. But in reality, what I'm looking at is the fact that this storm is going to have an impact on all these diseases. And this is what I'm concerned about. How does the COVID storm lead to an exacerbation or first presentation of some of these diseases? And what I am hoping people will understand is that the longer we have circulation of virus, the higher the risk is to the population. No, it doesn't fully. There are benefits depending on what your status is with regards to the jab, but I think the problem is that immunity wanes over time, and so this is a risk in areas where we have high circulation of virus. This is a risk that is going to be relevant going forward. Now, the other thing that I want you to know is that when I did the preparation for this, I'd asked a question to people who were interested in this. What were they primarily focused on? And this was the survey outcome. Quite interesting. For the majority of people, as you can see here in green, they wanted to talk about COVID complications. That's exactly where we are at the moment. Next in line was purple, and they wanted to talk about nutrition. Third was chronic illness management. And then you had heart health, and then you had lung and respiratory health, and then some other here. So you can see that what I'm trying to do is integrate everything under one umbrella. Because by then dealing with the COVID storm and how it overlaps with many of these things, and how nutrition can fit in the protection of this COVID storm. So, this is now where, this is the first time you'll be seeing me share this, what I consider the four pillars of storm protection. And I'll be going through this over time, breaking it down in more detail as to why I think this is so important and what I would suggest that you do with regards to it. Vitamin D, omega 3, glutathione, silica. You may not have heard much about silica. It's exceptionally important, and I'll be able to explain why this is such an important part of the four pronged pillar. And so, this is the approach that we're going to take. We're going to then be able to break down what we are seeing around us and then try and make sense of what is happening. One of the things that somebody had reached out to me with, and I thought that it was worthwhile sharing it, um, and I'll just share with you what he sent. I'll give the answer in the group, so I'll talk about it, but you'll I'll talk about it here live, but I'll give the answer to this to the group people who are on Zoom. So listen to what this person said. He said that his father had been diagnosed with pericarditis. Pericarditis is inflammation around the lining of the heart. So the heart muscle actually sits in a sac almost, and that sac is called the pericardium. And the lining between the fibrous sac and the heart muscle is called that pericardium, that space, and it can become inflamed. So his father had pericarditis, and he's had at least three COVID shots. He's not sure about the boosters. Um, they are strong believers in vaccines, and this is what they have been told. I'm not going to argue about that. He says he's not, and he is in his late 50s. He didn't take any shots. I don't know what his comorbidities are. He feels fine. The question is, how likely would these shots be responsible for his father's new diagnosis of pericarditis? And so they haven't found any specific cause at the moment. And the doctor had done the testing and the samples, and his father believes he now has to live with this. So the question was really, could this be related to what had happened before? All I will say at the moment, and I'll explain it in more detail, as I said in the Zoom discussion where people can ask me questions and so on, is that a lot of these things are very complicated. It's not necessarily so easy to differentiate and dissect out what the specific cause is. But what we do know is the associations. And that's where we then have to look carefully at timelines to be able to try and make sense of it. It's relevant because therapy is probably going to be quite different. And in this case, he would be having, in relation to it, more, I guess, not quite hypertension, it's more autoimmune kind of picture or autoimmune heart related symptoms that would be the cause of the pericarditis. Definitely, I can see how that would fit within a COVID storm. How we diagnose it and how we treat it is still needs to be dissected, and that's what this journey is about. By getting in front of people who are interested and people who have actual real symptoms, I will then be able to try and make sense of what is going on and try and find solutions. Just a reminder with regards to what is happening at the moment. Part of the problem that we have with regards to the storm is that people still keep on getting infected all the time. And this here is the principle. The more you can prevent virus from penetrating this mucosal barrier, the better you will be, because it's within the systemic immune system that the problems about storm, spike triggered autoimmune response mechanism are relevant. Now, this critical piece of information about storm is essential to trying to make sense of what is going on. Because here is what I think is happening. A lot of people are ending up with viral circulation through their bloodstream. So they get infected, the infection is not properly cleared, it then starts to circulate, it infects other cells and continues this persistent circulation. And it's this process that I think will lead to the principle of the storm, because the storm doesn't happen suddenly. It happens gradually over time because it's really about dysregulation of the immune system. And the big one that I'm concerned about is these NK cells or natural killer cells. These get depressed after infection. So the longer the virus circulates, it's taking out the CD8 T cells, the CD4 T cells, the B cells, the NK cells. In effect, it's acting as an immune suppressant. The problem is that it's not a full immune suppressant in the sense that it has an impact on what is happening in the body, but there are some cells that are not actually suppressed by this continuous infection. And one of them is the macrophage. And this is the one that I've been focused specifically on, is that this macrophage gets activated both by infection and antibodies. And the antibodies can be from infection or theoretically from vaccination as well. If these macrophages become activated, The problem is that they are normally controlled by about four cells, these myeloid suppressor cells, the M2 macrophages, the NK cell I just mentioned, and B regulatory cells. And what happens is that they start to release lots of ferritin. This is something I've been monitoring for years now, and it's quite interesting. Many patients have elevated levels of ferritin without any clear association of other causes of inflammation. And this is what I predict has happened. These activated macrophages are no longer able to be suppressed by the natural killer cells and the regulatory cells because these are depleted by persistent circulating infection. This macrophage then causes significant disease and leads to an exacerbation of all these other conditions. This is the essence of what I'm talking about with regards to storm. And this is why I'm so concerned, because the longer the virus circulates, the more likely it is that this is going to happen. What we don't know is who primarily is affected, because as with all things, it's never going to be everybody. Everybody may be at risk, but where are the risks highest? How can we identify them? What can we do? So, this education is going to be not just about what's happening with the storm, but also about how we can mitigate it, even if it isn't actually occurring at this time with you. So remember, for those people who are not yet part of this process, join us. Look out for the next link for the Health and Wellness Network. And for the people who are here with me, we will go on to answer their questions and look in more detail at what may be going on. So thank you those for joining me on YouTube, and we look forward to being able to share more information with you in the near future.